The province's plan to shut down the majority of Toronto's supervised drug consumption sites remain under fire tonight. Erica Natividad with why those who work in the facilities say the premier is making a big mistake.
They are handing out death sentences, but disguising them as care for people who are using substances.
A strong condemnation of the Ford government from frontline workers and advocates of supervised consumption sites. Nearly 1 week ago, Ontario's health minister announced that the province would be closing the majority of locations by the end of March 2025. It would be 10 out of 17 provincially regulated sites in total, with 5 of them in Toronto that are within 200 meters of a school or childcare centre. It's a move that workers argue will end up costing thousands of lives in Toronto.
The science is clear. People are not going to stop using drugs simply because these sites are closed. What will happen is that they will use drugs in public spaces, putting themselves and others at greater risk. This policy will lead to an increase in ambulance calls, further strain on our public healthcare system, and longer wait times in an already overburdened emergency rooms.
It will increase HIV and hepatitis C rates, and it fundamentally denies the right of a group of people their access to needed health services, period.
The claims have been backed up by a number of reports commissioned by the province on how to run the sites better, from Unity Health and from site supervisors. Though the premier today again standing firm in the decision on the closures, citing safety issues he's heard from residents.
They're leaving the needles out there in the parks. I get calls every single day. Certain communities can tolerate that. The communities I hear don't want it.
In the recommendations in the reports, it didn't say anything about closing a site or moving a site. It just recommended more communication.
Ford also referencing the treatment centres that will replace supervised consumption sites. The province is spending $378 million to help fund what it calls homelessness and addiction recovery treatment, or HEART hubs, that it says will add up to 375 supportive housing units, in addition to addiction recovery and treatment beds.
Those will still be located next to childcare centers and schools. The work is already being done. Would I work at an abstinence-based model? Show me the evidence that it works to stop a toxic drug death crisis, and I would take it into consideration.
Now, these workers say this isn't an either-or approach, that all of these services should work together, and they're actually calling for expanded access to supervised consumption sites and various evidence-based treatment types. In downtown Toronto, Erica Natividad, City News.